Good evening. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we find problems in the healthcare system and then try to take actions to make a better system for all of us. Today we have a whole bunch of topics, including medical debt and reproductive rights, private equity, not my favorite. But before we get to them, down below in the YouTube description box, you'll find a link for today's Healthcare Advocacy newsletter, which is the text for today's video. You can, of course, go there, subscribe for free, and have those messages delivered to your inbox almost every day. Let's get started. Let's talk about medical debt. New Orleans-based Ochsner, I hope I pronounced it right, hospitals and clinics serve Louisiana, Mississippi, and Alabama. They are now working with Undue Medical Debt, that's UNDUE, a New York nonprofit, to wipe out, get this, $366 million in medical debt for about 193 needy patients. The Times-Picayune / New Orleans Advocate, that's a newspaper in New Orleans, reported Wednesday that the deal involving Ochsner Health was arranged by Undue Medical Debt, which is a donor-funded organization that negotiates with hospitals, doctors' offices, ambulance services to purchase and erase the outstanding medical debt of those least able to afford it. So I guess that's it. Those hospitals will get some money out of it. Good enough for me. Anyway, the deal followed an announcement earlier this week of a similar agreement between Ochsner, Undue Medical Debt, and New Orleans to wipe out more than $59 million in medical debt for about 66,000 people in that city. Undue Medical Debt typically is able to purchase the medical bills for about a penny on the dollar. Okay, look, I'm telling you this story for a reason. Medical debt stinks. Universal health care wipes it out, but we don't have it yet. So if there's something burning a hole in your pocket, you can help. You can I put a link in the newsletter, and I'll put a link in the YouTube description box. You can send them the change in your pocket or something. You'll feel better. Let's talk about COVID-19 vaccines. The FDA this past week gave its approval to the updated COVID-19 vaccine for the 2024-2025 season, preparing for an unexpected spike in cases this fall and winter. So get ready. Both Pfizer and Moderna's updated vaccines were granted full approval for people aged 12 and older, and they're authorized for emergency use for children 6 months to 11 years old. The approval comes as COVID-19 infections have increased this summer, according to wastewater data collection by the CDC. Experts predict that COVID-19 will spike twice per year, in the summer and in the winter, based on how the virus has evolved in past years. The FDA is planning to update the vaccines once per year based on the same timeline that annual flu vaccines are updated, depending on which strain is circulating. In recent weeks, people have been hospitalized with COVID at a rate nearly twice as high as during the same time last summer. By late July, COVID was killing about 600 Americans a week, which is a substantial drop from this winter, but it's double the number from this spring. There were weeks in the spring where it was down to like 200 people a week, but we're heading back up. The availability of boosters has not translated into actual vaccinations, which is why I keep repeating stories like this. By spring, only 1 in 5 adults had received last year's updated COVID vaccine. Can you believe it? Even older Americans who are at far greater risk of being severely sickened largely did not get the shots, with only 40% of people 75 and older getting last year's vaccine. I'm just speechless by that kind of behavior. Anyway, unvaccinated children between the ages of 6 months and 4 years can receive either 3 doses of Pfizer's vaccine or 2 of Moderna's. If they've been previously vaccinated, they can receive either 1 or 2 doses of Moderna's. I think for this latest vaccine, I'm going to go off the script here and say you probably have to wait just a tiny bit because they need to approve all the way down to young children. Make sure you check with your pharmacist or your doctor. The number and the timing of doses will depend on when they received their last shot, according to the FDA. People 5 and older are eligible for an updated shot at least 2 months after their last COVID-19 vaccine, the FDA said. Okay, everybody go get vaccinated. The majority of people who were hospitalized for COVID-19 this last year, get this, had not received an updated vaccine. That's according to data presented to the CDC's vaccine advisors this past June. Okay, get the vaccine, stay healthy. My wife and I are booked for our appointments. We did it online. We booked them online. We're going next Friday. We're going to get COVID in one arm, flu shot in the other, and I'm pretty sure there's ice cream at the end of the injection. Okay, let's talk about abortion news, which is not good. The Arkansas Supreme Court ruled yesterday that abortion will not be on the ballot in November, upholding the state's rejection of a petition to bring an abortion access measure before the voters because organizers failed to submit required paperwork on time. You know what? It sounds like they didn't have all the signatures. That's a BS. Let me tell you what they didn't submit. They were required to provide certifications of the ability to collect signatures by people who were paid to stand outside the grocery store and collect signatures. I don't know what to say. In a narrow 4-3 ruling, the court's majority sided with the Secretary of State, John Thurston, a Republican, who in July rejected the petition submitted by Arkansas for Limited Government that carried over 100,000 signatures because the group, as I said, did not submit the training certificates for paid canvassers. I have a little bit of advice for you. Vote accordingly. This is such disingenuous behavior to keep women subjugated. Just vote accordingly. Okay, let's talk about a private equity disaster. New Mexico's Attorney General is investigating Memorial Medical Center, which is operated by LifePoint Health, to determine whether the facility highlighted in a recent NBC News story, link in the newsletter, violated state laws by turning away indigent and low-income patients seeking care. The investigation focuses on Memorial's patient policies for compliance with a state law and the hospital's performance under the New Mexico statute governing provision of care to needy patients. There is evidence that Memorial Medical turned away cancer patients under its operator LifePoint Health, which was acquired by Apollo Global Management, the New York-based private equity firm. Physician records and interviews with 13 patients detail the denial of care by the hospital or demands of upfront payment to secure treatment. They're not supposed to do that. LifePoint runs Memorial. The facility, though, and the land it sits on, get this, are actually owned by the city of Las Cruces, New Mexico, and Doña Ana County. In addition to potentially violating the state law denying care to patients, they are probably violating their 40-year lease, because in the lease it says you have to treat the indigent. The lease says the facility must generally continue to provide care to those unable to pay the full cost of healthcare services rendered to them. That means you render the services first. You don't ask for money up front. Okay, LifePoint Health oversees the largest chain of mostly rural hospitals in the U.S., 62 acute care facilities in 16 states. LifePoint is the subject of 2 U.S. Senate inquiries, along with other healthcare companies owned by private equity firms. NBC News has reported on this previously. There's a link to it in the newsletter. The Senate investigations want to assess the profits that Apollo and other private equity firms took in their deals and whether they harmed patients and clinicians. Apollo said it's cooperating. Sure they are. Private equity firms like Apollo have taken over much of the healthcare industry in recent years. The firms typically load debt onto the companies they buy, Then they cut costs to increase earnings and appeal to potential buyers later on. Almost 1/4 of New Mexico's hospitals are controlled by private equity firms, according to a study by the Private Equity Stakeholder Project, link in the newsletter, which is a nonprofit that analyzes private equity's impact on consumers. Independent academic studies have shown that private equities firms' involvement in the industry results in a significant cost increase for patients and for payers such as Medicare. Lower quality of care has also been associated with the firm's investments in healthcare. Research shows, this is a sad one, when they buy a nursing home, within 1 year, 10% increase in mortality. We've also found that in hospitals, briefly going off script here, we've also found increases in infections and in-line infections, like those are direct lines that feed medicines into the body. Those things are like never supposed to happen. You're never supposed to get those. Also, a lot of significant increase in patients slip and fall while they're in the hospital. That's never supposed to happen. And the reason these happen when private equity takes over is because they've cut staff and they don't have enough people watching the patients. Okay, big deep breath. There's legislation in Congress that will address this kind of abysmal behavior that private equity has put on us in healthcare. It is called the Health Over Wealth Act. It outlaws all of these behaviors we've talked about. It also includes a 5-year escrow that the private equity company has to put up to keep the hospital running to serve the community in case they decide to go bankrupt. You know what? Let's share this example, this New Mexico example, with our representatives, our senators and our members of Congress, and get them to take action. You can contact them by phone or email. I'll put a link in that to how to contact them in the YouTube description box, or you can send a text message using ResistBot from your cell phone. Here's the message: sign, SIGN, PXNDQO. That's sign, PXNDQO. There's a space between those two, to 50409. Here's what you'll say: I'm your constituent and I want you to know that private equity giant Apollo and their hospital management firm LifePoint have been turning away poor patients in Las Cruces, New Mexico. Link to the NBC News story so that you and your legislative analysis staff can read it. They did this even though they violate New Mexico law and their lease for the hospital building and land from the city and county, which specifically prohibits this kind of behavior. When are you going to say enough is enough? I want you to co-sponsor and get the Health Over Wealth bill to a vote so private equity firms can no longer exploit patients to provide way above market returns to investors. I'll include a link in the email to Senator Markey's Health Over Wealth bill, the summary, so you can go and read that. You were sent to Washington to help your constituents. How about it? Get this bill passed in both houses, because we're counting on you. That's what I've got for you today. Down below, you can like, share, and subscribe. Send me comments. Send comments to healthcareadvocacy1@gmail.com. Anything you'd like me to review for you, I'd be delighted to do it. Thanks a lot. Have a good evening.